I want you to help us understand, as a medical professional, what worries you most about what we're seeing across this country and specifically in Texas?
Yeah, I've been in Texas providing abortion care for over 7 years now. And what's important to remember is abortion is healthcare. This is something that is usually between a clinician and their patient. And there are oftentimes complex decisions that we have to make. And what's happened most recently is that politicians have inserted themselves into my exam room and made the care that I provide very complex. And what we have right now, with Roe most likely being overturned, is many of my patients and the people that I take care of will no longer be able to get safe care and will be potentially in harm's way.
Many abortion laws, of course, make exceptions to save the life of a mother. A lot of talk about this exception being removed. What does that practically mean? I mean, walk us through the scenarios where you are having that conversation.
Yeah, what happens sometimes when these laws are defined by politicians who don't practice medicine and they say something like, unless the person's life is in danger, it's not clinically defined. What does that mean? Does that mean a temperature? Does that mean a certain kind of blood test? And what we do as physicians and folks taking care of patients is we have these conversations. We assess the situation. We talk about risks and benefits and alternatives, and we make that decision with our patients. And sometimes these things are very complicated and nuanced, and it's important to leave those things in the hands of medical professionals who have the training and expertise to provide that care for people. And so what I worry about in the direction that we're going, where abortion care has become so politicized, is that physicians and nurses and healthcare professionals like me are left sort of questioning what the law is and what we can and cannot do, and how we may even have those conversations with our patients. And that's potentially very unsafe.
You're in a state that's moving to ban abortion-inducing drugs that many women who are suffering miscarriages need to take. What then is the consequence of not having these drugs? I mean, what is then the alternative reality if they're not available?
Yeah, again, in Texas, we already essentially are in a post-Roe world where so many of the options for people who are having an early pregnancy loss or miscarriage aren't able to access the care they need because it's become so siloed and difficult to access. And there's law after law that doesn't make any sense. It's not designed to help people, and it's really designed to make care hard for anybody who's pregnant, whether they're seeking an abortion or seeking a miscarriage. And again, in Texas, we have some of the highest maternal mortality rates in the country. And the United States overall has very high maternal mortality rates, and even higher among Black women. And those are only going to get worse if we continue to go in this direction.